in this facility, a quiet revolution is on. It is a century-plus-old medical institute that started out as the West African Council of Medical Research in 1920 to research into prevalent communicable and non-communicable as well as neglected tropical diseases. Over the years, NEMAR transformed into a point of reference in basic, applied and operational research for the promotion of national health and development. More recently, it was here that the first case of the dreaded COVID-19 was sequenced in Nigeria to give the country a direction into the nature of the pandemic in 2020.
For those who went through the incidents of Ebola and in the COVID pandemic and how we survived, this man here, this professor, and some of those who sit on this podium, like Professor Abayomi and Professor Adewale, and many of those in this room, are some of the unsung heroes of the success of those undertakings that Nigeria went through.
The post-effect of COVID-19 on human and efforts to develop locally made vaccines for such a public health challenge are in the works here.
What happens in Naima?
The man that led the revolution in the last 8 years is Professor Babatunde Salako.
And it will interest you to know that the first HIV case diagnosis was made in Naima, very many years ago. And since then, Naima has been an HIV research center. Malaria is also something that the institution has played a significant role over the past years. We've been involved in testing the long impregnated insecticide nets, which are being used to control malaria vector.
He's buying out of office, but those who fully understand the impact of his leadership on the activities of NEMAR and Nigeria's public health won't let him go without a befitting send-forth. They include his two-time boss and former cabinet minister directly supervising the institutes.
No one will fail to recognize the transformation that has really taken place in NEMAR in the last 8 years. For the first time in the history of NEMAR, you look after the welfare. Professors came out of NEMAR. You supported the battle against COVID. You developed quite a number of innovative instruments and developments that we should be proud of.
Big deal. Also, in 8 years, NEMAR's allocation increased from a paltry 50 million to 2 billion naira annually, but it's not anywhere near enough for an agency of NEMAR status.
When you are talking about having a research institute, the biobank is a key infrastructure that must be put in place. You do not have an opportunity of collecting biological samples from research participants indefinitely. Every opportunity that an individual, a human being, give you a biological specimen is a precious specimen which you can use immediately, but there's always more research questions to be answered that you cannot think of as of present. So if you are able to keep those samples perennially, indefinitely, you can always be able to fall back on those samples to answer newer research questions based on what you have done before. I talk about samples of human lymph node that has been kept in the Guyton's Hospital in London since 1762. And we are still assessing those samples to answer new research questions as late as 1994. This is the kind of a thing that the authorities in NEMAR is trying to put in place.
There is a growing advocacy for a wholly indigenous funding for medical research to aid the activities of the institute and other researchers.
In America, the budget for research at the NIH, I can't even mention it because it's bigger than some states' budget. And that is how much they focus on the need to do research and development. It is only with research and indigenous funding of research. So our government must fund our own indigenous research in Nigeria.
For me, I didn't realize the enormous work one had done and how well people have appreciated it.
But advancing the revolution that has started here no doubt goes beyond who is taking over from Professor Salako. It lies in our collective understanding that external funding won't do much in researching into our genetic structures and determining the proper solution to our peculiar medical challenges as a people. Tokumbo Oyetunji, Arise News, Lagos.